Rowing may be something that you feel comfortable doing throughout pregnancy. It might be something that feels weird or uncomfortable at some point during your pregnancy. That can be different stages for everyone. So you may need to just modify by going to walking with some type of load like kettlebells, or carrying something, or go to skiing or biking as a substitution. If you're going to continue to row, there are some things that you might find that you can do a little bit differently to make it more comfortable and to continue rowing through pregnancy. One of those things is changing the damper setting. So you may actually find that you like a higher damper setting a little bit better and lowering your stroke rate. So if you normally do like a 27 strokes per minute, maybe bumping up the damper a little bit higher and then trying to take like a 22 to 24 strokes per minute could be a good option, because it lets you focus on that breathing and gives you a little break at the end. It also is going to be like a shorter stroke, because you're also not going to lean back quite as much. So when you lean back at the end of that, the end of the row stroke, what could happen is that you may feel like a pull, or you may notice some coning. If you look down, you're probably going to be more likely to notice coning, because when you tuck your chin, whether you are on the rig or whether you are like in a sit-up position or just looking down, anything like that, you're going to notice that little bit of a cone. A better assessment to see what your abdomen is doing is to set up a camera or to ask somebody to look at your abs as you go through that rowing position. That way you can get a better idea of what's happening when you're in a normal rowing position, since no one really rows looking down at their stomach. If you notice some coning and you want to try to modify your rowing position before you totally go ahead and throw out rowing, there's a couple of things that you can do. So I'm going to kind of demo how you can change that. You're going to notice that you're not going to be able to go up as far either once your belly starts to grow. So your stroke is going to be pretty short. Let's pretend like it's about here. And then when you come back, you're going to be more upright and kind of acting like that pull. So you're not going to lean back like you normally would. Still going to have straight arms, and then let our knees bend. Again, might not be able to go quite as far. You might find yourself rolling or pushing your knees out to kind of make room there. You also are going to be able to focus on your breathing, but go ahead and expect your pace on the monitor to be slower than you would normally expect it, because you have way less of a stroke and you're not going to be going as fast back and forth.